Hello, everyone. Thanks for joining us for this edition of Medical Minute. We are talking today about March being Colorectal Cancer Awareness Month. It's such an important conversation to have because we want to encourage all of you out there to make sure that you're getting the screenings of every kind that you can. But certainly, colorectal cancer has been seeing an uptick, been trending upwards in terms of people being diagnosed at an even earlier time than the actual statistics show that your age should be about maybe 45, but now we're seeing it even earlier in some patients all around the country. So joining today is our very own Dr. Abdul Jazieh. He is the Director of Innovation and Research, and he knows a lot about colon cancer. And we also have a survivor with us today. That's Deb Meek. And Deb is really just a very new survivor in the 1 year time frame-ish. And we're going to hear a little bit about her story. But first, I want to talk to Dr. Jazieh. Dr. Jazieh, tell us, what do people need to know about colorectal cancer?
Well, thank you, Sherry, for having me, and it's good to have you here, Deborah. So colon cancer actually is very common cancer. Actually, the lifetime risk is about 1 in 24 men and 1 in 26 women will have colon cancer. So it's very important. Actually, it's the second cause of cancer mortality. So it's also causing a lot of cancer death. Unfortunately, more than 150,000 people, men and women, are diagnosed with cancer a year in the US. And almost a third of that number will be dying every year from colon cancer. So it has to be taken seriously. Men and women are affected by it. And as you mentioned earlier, actually, we are seeing now more and more younger patients being diagnosed with colon cancer.
Why do you think that?
Well, there are, of course, there's no specific one reason to pinpoint. And usually it's multifactorial because of the risk factor of colon cancer usually is related to the diet, the lifestyle, and there's something also in a small percentage of the patient related to genetic inheritance of risk from family. So there are multiple factors, but for sure, the risk of now or the incidence of cancer in younger patients is increasing significantly. Like for those below age 45 is almost increased by 2.5% or 2.7% every year. The incidence of seeing younger patients with cancer increasing every year. So that's that's a very notable observation in the medical practice.
Yes. Well, Deb, thank you, Dr. Jazieh. Deb, you are a colorectal cancer survivor, yes. But you have a very interesting story because, you know what, you were going about your business one day and not really paying attention that much, I would say, to I'm supposed to be getting this at this time of my life. So give us a little bit about how your cancer was actually discovered.
Sure. So not a young person, obviously.
You're very young.
Actually, it was kind of funny. I was at a benefit fair, employee benefits, and they had one of those blow-up archways that was simulated to look like a colon. And there was GI folks were there, and we walked through. There were polyps and cancer, and I said, I had never had one. I've just been too busy. And they were stressing the importance of getting it. So that, along with a really good friend of mine, one of my besties, kept pestering me about getting it. And finally, I did get it almost a year ago 2 days ago would have been a year since I had that colonoscopy. And lo and behold, it was discovered that I had a tumor. And they did the pathology. In fact, it was cancer.
When you heard that it was cancer, what went through your mind? What was the first thing, if you can think back, as to what went through your mind?
Well, my sister, she 3 years ago was diagnosed with pancreatic cancer. And most people know that's you usually don't survive that. But she did. She went through the chemo. She went through a very extensive Whipple surgery. And she's here today. She had another CT that was just recently that showed that she was free of cancer. Yay. And so I just thought, if she can go through all that, I'm going to beat this.
Yes.
Yeah.
So you know what? Let's talk about beating it. We're so glad you're here. We're so
Yes.
glad that you went to that health fair and you saw what you saw and you took action. Dr. Jazieh, what do people need to do to take action? What do they need to know? Are there symptoms? And if they feel it, they should go get checked out. The age now is what? Is it 45? But if you have even higher risks, like genetics, I think it's lower. Talk to us.
Yeah. So fortunately, at least colon cancer is one of the very preventable cancer that, as we know, in many cancers, and specifically in colon cancer, if we discover the cancer at earlier stages, the cure rate will be very high. Now, even better yet, and as Debbie mentioned that, when she went through the simulation, she found polyps. Actually, the testing we are going to talk about actually can prevent cancer from even happening to start with. So that's even very important issue. So you'd rather remove the cause of the cancer to start with and not to have cancer. And that's why the screening, there are multiple tests. So if somebody is concerned about one, please discuss that with your doctor. So there are following tests that you can do. The most important one in my mind is actually full colonoscopy. This full colonoscopy is, basically does two things. First, it looks at the whole colon and it removes any polyp. So, so that's, almost a treatment and prevention of any, and of course, if there is any early cancer, it will be detected. But then there is also partial, sigmoidoscopy. The colonoscopy has to be done every 10 years.
Mm-hmm. Okay.
The sigmoidoscopy is every 5 years, which basically they don't look at the whole colon. Then there is CT scan, CT scan imaging. So by radiology, they do that, and then that should be done every 5 years if we go that way. And then there's, of course, stool testing that we've done either 1 year or every 3 years to look for any blood or any markers of cancer. And that should be done every 1 year or 3 years based on the test. And the last thing now, there's recent approval from FDA of doing blood tests, actually.
Yes.
There's a new blood test to detect colon cancer with just a blood test. But I still think the gold standard is to do the colonoscopy because you look at the whole colon and you remove anything you see. And that, in my mind, is the best option. But if somebody is concerned about that and so on, I don't want them to give up totally screening. Now, this should be done for people who are average risk. Average risk means none of the family member has cancer and are not known to have polyps and so on. The average risk, everybody should have screening starting at age 45. And if it's colonoscopy, it will be done every 10 years if they did not find any polyp. If they find polyps, then, the intervals will be reduced to 3 to 5 years, basically. Mm-hmm. And if you have a family members with the first degree, especially a family member, like a father, mother, sibling, then the test should be done at age 40 or 10 years younger than the family member who has cancer. Mm. So if your father has colon cancer at age 45, then you should be screened at age 35.
Wow.
10 years younger. But if the father, let's say, or the mother had colon cancer at age 60, the son or the daughter should be screened at age 40, not 45. Mm-hmm. So 10 years younger or at age 40, whatever is earlier.
Yes. That's great information. Debbie, when you went and got your colonoscopy, did you have any kind of concerns at that point about did you have any symptoms of any kind that might have suggested?
Right. Well, looking back, yes. Mm-hmm. But at the time, no. I assumed some of the things that I was experiencing was just a part of, having been a mother of two and, mm-hmm. And getting older. But so it was kind of a shock to find out. And then, going into, right into oncology and then meeting up with my good friend, Jenny Matthews from mm-hmm. USI, who recommended that I come and see CCA, Cincinnati Cancer.
So you are a former patient, and you were seen by Dr. Jazieh here.
Yeah.
So and that's your friend of you are a friend, I should say.
Yeah.
One of the things that, again, you said you had some symptoms, but Dr. Jazieh, sometimes people don't know what those symptoms are. And sometimes they may just be feeling you may think, oh, I have abdominal pain,
Right.
Yes.
but not all abdominal pain. That's one of the symptoms is necessarily a colon cancer. So what symptoms are most prevalent?
Yes. It's very important actually to realize that screening without symptoms is the most important thing. So I don't want people to wait till they have symptoms.
Exactly.
But sometimes the body sends signals. Actually, many times the body sends signals of early cancer. And, these are then called early detection. So what you have to basically act properly and ask and seek medical help. So some of these symptoms basically, because in the colon where the GI tract drain, the food remnants, so the first thing you will have, you may have cramps, change in the bowel habits. So please watch, if you are going to the bathroom less often, or you're having constipation, or change in the stool texture, it's becoming harder and it's becoming the shape of the stool change. These are very important signals. And of course, the alarm that, gets everybody, blood. If you see blood in the stool, please, if you see blood in the stool, do not assume it's hemorrhoids. Yeah. Do not assume it's hemorrhoid. That's actually one of the most common mistakes, medical mistakes. Mm-hmm. You see blood in the stool, or change in the color of the stool, you need to seek a medical help and proper testing. Of course, there's other things, but the most important thing, anything in the abdomen, mm-hmm. in terms of cramps, change in the bowel habits, seeing blood and changing in the stool, and seeing blood are the most common symptoms. Of course, there are symptoms, that advance, and I hope the patient doesn't reach that point where you start having weight loss or pains in different part of the body, in the liver or something. So this is our advanced signs. We don't want to reach that point.
A lot of people now, there's the Cologuard that's out. And a lot of folks think that, if I just get that, I don't have to get a colonoscopy. But that does not, take the place of a colonoscopy, correct?
Absolutely not. In my mind, no. Actually, colonoscopy is the gold standard, but doing the Cologuard or other tests is better than doing nothing. But that doesn't replace colonoscopy.
So as we're wrapping things up, Deb, what would you want to, having been in the situation where you were diagnosed with colon cancer, what would you say to the audience out there? What would you want to really, bring home to them?
I think most importantly is, like Dr. Jazieh says, to get your colonoscopy. I had the little FIT test, mm-hmm. and it was negative. So my cancer was found on the colonoscopy. And I waited too long, mm-hmm. because, we assume that we have hemorrhoids, especially after you have children, as a woman. So any of those symptoms, cramping, that kind of thing, I just get the colonoscopy. It saved my life. Yes. Because if I had waited any longer, the stage of my cancer would have progressed. Had I went sooner, mm-hmm. it would have been a polyp, right, Dr. Jazieh? And they would have been able to remove it, and I wouldn't have to go through, the chemo.
Well, and you're doing great now.
I am, yes. So coming to CCA, my treatment plan was looking like it was going to require more than one surgery, mm-hmm. type of thing. And so, coming to CCA, I was referred to a wonderful surgeon who was able to get it all in one fell swoop.
Wonderful.
And got clear margins, which everybody wants to hear, right?
Exactly.
And so I am sitting here today cancer-free.
Yes.
And I'm going to stay that
Wonderful.
way.
That's what I say.
Congratulations.
We're going to stay
That's
that way,
good.
right?
Yes.
Well, Deb, thank you for being here.
Thank
We're going to
you.
close out with Dr. Jazieh. Once again, Dr. Jazieh, thank you for being here. But you want folks to, again, reiterate that they need to take action.
Yes. So we have talked about the screening, but there is even better way than not to have cancer at all, actually, mm-hmm. which is basically taking care of the lifestyle. And usually the lifestyle has two major components. One is what you eat, and then the second thing is the physical activity. And of course, the third thing is to avoiding the harmful stuff. So no alcohol, no smoking. These are risk factors are modifiable. You remove them. Diet, you lean on plant-based food, cut down on the sugar, and cut down on red meat basically for the colon cancer. But I tell my patients usually eat plant-based food as much as you can, cut down on the sugar, cut down on the processed food, protein and fat is in moderation. Then the other thing, physical activity. Physical activity, especially in colon cancer, has anti-cancer activity. So if somebody exercise, will be less likely to have cancer. If you get rid of the cancer and you exercise, the cancer will be less likely to come back. So we advise our patients to exercise, and those who are healthy, don't have cancer, please exercise.
Yes.
And then go from there. Exercise usually should be mixed aerobic and non-aerobic exercise, minimally 30 minutes a day of aerobic exercise, 15 minutes of resistant exercise a day, 5
Just
days a
get
week.
out there.
Yep.
Get to moving, get physical.
Yes.
Thank you, Dr. Jazieh,
You're
so
welcome.
much. And thank you, Deb. Folks, know your family history as well, and just make sure that, you're getting those screenings in a timely manner. And even before, if you even think that something may be going on. Thank you so much for joining us for Medical Minute. Please share it, subscribe to it, and also like it so that we can get this information out to as many people as we possibly can. Thanks and take care.